Health Minister Greg Hunt, thanks very much for your time. We've had the fourth straight day of more than 60 cases in Victoria. How concerning is this latest number?
This continues to be a matter of very serious concern, Kieran. This is why we have both supported the decision, the difficult decision, to apply not just rapid testing, rapid tracing in high volumes, but also the local restrictions. And I know for those that are within the 10 postcodes and 36 suburbs, the over 300,000 Victorians who are being affected, this is a very difficult time. But unfortunately, it's a necessary moment. It's what we've always said. There would be outbreaks, and therefore we would need rings of containment. It's what we did in northwest Tasmania. It's what we're doing now. It's what will help keep us safe. So we regard it as serious, but we have in place, I believe, now the Victorian Government has accepted a program which is most likely to contain and control the numbers.
When you say most likely, are you confident that Victoria will get on top of this?
I think it's far more likely than not. Nobody is in a position to make false promises, and myself, the Prime Minister, the Chief Medical Officer, Professor Brendan Murphy, and his successor Paul Kelly, throughout we've been very careful and cautious not to set false expectations. We are going to have to live with this disease for a long while to come. We know around the world the numbers have soared beyond 10.5 million. Sadly, over 510,000 people have lost their lives officially, and it's likely that the real numbers are far higher than that. So this is a global challenge. Australia has been largely insulated by comparison. We've been an island sanctuary, but there will be outbreaks. And we believe that this model, the local containment model, is the most likely to be effective. It's what will prevent the spread of the virus and the spread of the economic contagion as well. But we're daily monitoring, and we've seen 50,000 tests yesterday, over 20,000 in Victoria, an overwhelming focus on these areas, the rapid testing in high volumes, the rapid tracing, but very difficult for the population, the local lockdowns.
Yeah, indeed. It must be frustrating for those Melburnians who did the right thing and, like the rest of us, had to keep to themselves for so long. It's not easy, but it must be frustrating for you too, as the person at a national level overseeing all of this, because it seemed like we were so close to almost eradication, and yet this couple of mistakes and then boom, we've got a spike.
So in 7 out of 8 states and territories, we're in a very, very strong position. Nobody should claim to be immune from outbreaks. It could happen in any state or territory. In Victoria, we had an underlying low level of community transmission, but then obviously the breaches in the hotel quarantine, and at the same time we had the demonstrations, which then led to a clear relaxation in some parts of the behaviours. And so those two things combined meant that we've seen an outbreak in Victoria, different from other states because they didn't have that level of underlying community transmission, and they didn't have the breach in the hotel quarantine. So our job is to focus on helping each state and territory get through this. We've helped Tasmania, we've helped New South Wales, we've helped in Western Australia with the Artania or Northern Territory with the Howard Springs quarantine. Now it's Victoria, and we're providing the resources, the ADF, the tracing personnel. So all up, almost 1,000 Commonwealth personnel or Commonwealth organised are coming into Victoria to assist with that. 200 last week. This week we're mobilising a force of 800 to assist. Yeah,
indeed, and no doubt those residents would be welcoming the greater presence of federal authorities too, no doubt. But when you look at the way that quarantining was done, you've got the the hotels, and now these reports in the Herald Sun that there was, in fact, sexual relations between some of the guards and the people in quarantine. They're quite bizarre scenarios that we're hearing about now in the context of what is a pandemic response. Is there substance to that, and are you looking into that in terms of this investigation that we've got underway?
So there's a judicial inquiry, so at the very highest levels, which Victoria's commissioned, and they will do the investigation. But if the stories are correct, then what I've said and what I believe is that the Victorian authorities should throw the book at the individuals concerned and those who oversaw that process amongst the contractors. But we do know definitively that there were breaches that came out of them. We have offered assistance in terms of the ADF and around the country. Just to put all of this in context, we've brought 60,000 Australians home through the hotel quarantine system. In 7 out of 8 states, that's worked incredibly well. In Victoria, it has overwhelmingly worked well, but 2 clear breaches. And what this shows is the standards have to be incredibly high, and that this is an unbelievably contagious disease. And this disease does not respect any borders, any boundaries. It is contagious, and if people with professional responsibilities don't maintain those responsibilities, then the rest of the country suffers as a result. So any one of us can save a life, any one of us can risk a life. All those rules, distancing, hand hygiene, we're encouraging people to continue to join the 6.5 million Australians that have downloaded the COVID Safe app. All of those things will need to be with us for a long time going forwards.
A couple of questions before you go, and to try and leave on a more optimistic note, because you did say it's more likely than not that Victoria will get on top of this. And I guess the question I want to ask you is, in terms of these numbers, while they're still quite high, are we seeing potentially a levelling out with a couple of days in the 70s and with the high testing rate that you spoke about earlier?
I think that is right. I think we are seeing at this point a levelling. Whether that's sustained, we'll see. But the actions that are being taken will give us the best chance. Now, there are many layers which can be taken. That what we've done is worked with the Victorian authorities. We've given them support, we've given them encouragement, we've given them assistance. They've gone now to what are called their stage 3 restrictions in Victoria. They're difficult for the population, and that means that we're able to contain it to those 10 postcodes. And for those, again, in those areas, I am sorry you are having to go through this. Overwhelmingly, the residents have done the right thing. And I want to thank you for being tested, urge you to continue to be tested, but not just those within those postcodes, others within the broader regions. It's very, very important to be tested. And anyone in Australia with symptoms, we'd urge you to be tested, because each of us can keep the other ones safe. Now, I am optimistic. What we've achieved as a country is amazing, extraordinary. It's globally recognised. But we have to be vigilant. And this will be with us. And as a country, whilst we're doing incredibly well, we can't let our guard down, and we have to work in partnership. And it's been a partnership that's protected us. But do I believe we'll get there? Yes, I do.
And speaking of getting there, do you think that our researchers, or if not ours, those internationally, will have a vaccine? What's the latest advice you have on that? And also for effective treatments of COVID-19, not just the vaccine component, but the treatment of those who contract it. What are you hearing on that?
So on the treatments, there are 2 that are more promising than others at this stage. Dexamethasone, and we have plenty of supplies that's readily available in our hospitals. That's for critically ill patients. And then remdesivir, and we saw that there may have been a global shortage. We got ahead of that. We have the supplies that we believe would be needed for Australian hospitals as we speak. And so they're already in hand. So there is a global shortage now. We were fortunate to foresee, forewarn and to act and to get ahead of that. On the vaccines, nobody can guarantee that there will be a successful vaccine. There are 190 plus vaccine candidates. One of them, the University of Queensland molecular clamp, into which the Australian government's invested $5 million, is one of the top half dozen candidates in the world. And I'm becoming hopeful that at some stage one of the vaccines, if not others, will progress and become available. Some are being trialled in humans. An interesting point that was made to me by one of the global CEOs is it may not necessarily be the polio option, where effectively the vaccine was a complete prevention in almost all cases. It might be that you have a vaccine in the early stages which is more like the flu. It reduces the numbers, it reduces the impact. It's not universally effective, but it saves a lot of lives and prevents a lot of infection.
Well, we hope that that is what, that there is an achievement on that front sooner rather than later. Thank you, Health Minister Greg Hunt. As always, thanks.
Thanks, Kieran.